I'm going to explain the methods of induction of labor to you in a way you will never forget. So make sure you stay to the end of this video. For induction of labor, the method is based on the readiness of your cervix. And for us to have a baby, we need your cervix to soften up, thin out, and then dilate. Induction simply means getting your body to start contractions artificially without it starting on its own. It can be done using medications and it can be done without medications. On the day of your induction, if the provider checks your cervix and sees that you're still closed or less than 1 centimeter dilated, the method they go for is medications. This can be oral medication or medication that is inserted into your vagina. For oral medications, we have misoprostol. The second medication goes in your vagina. So this is called Cevidel. It's like a little thread infused with medication. The provider puts this behind your cervix. It releases the medications gradually, and these medications help your cervix soften up and ripen up and then dilate. These oral and vaginal medications typically take a long time compared to the other medications. If you're giving Cevidel, you can be allowed to go home and come back when you're having regular contractions, when your water has ruptured, or when you're feeling so uncomfortable that you need to come back. If your provider checks you and sees that you're above 1 centimeter, so 1 centimeter, 2 centimeters, they can do a mechanical induction. This is done using a Foley catheter. So this is a tube that has a balloon at the end. This tube is inserted into your cervix through your vagina, and then the balloon at the top is inflated. The inflated balloon puts traction on your cervix and then helps it dilate by itself. It also provokes your cervix to produce its own prostaglandins that helps it soften up and start dilating. We keep the Foley in until it falls out. Once it falls out, depending on how much fluid was put in there, you could be like 3 or 4 centimeters dilated, and then your contractions will kick in from there. If after the Foley, your contractions do not kick in, other methods can now be used, like artificial rupture of membrane, or you can be given oxytocin. Now let's talk about artificial rupture of membrane. If your cervix was checked and you were above 3 centimeters dilated and your baby's head is well applied to the cervix, the provider could do artificial rupture of membrane. This means going in there to break your water to start contractions. And lastly, we have oxytocin or pitocin. This is given via IV. And this is usually given when your cervix has been determined to be favorable enough for you to dilate. Once you're giving oxytocin, both you and baby need to be closely monitored. So baby will be hooked up to the monitor, and the oxytocin rate is gradually increased until a regular contraction pattern is attained.